Hi, guys. Today we're here to talk to you about how you can talk to your patients with cardiovascular disease more about their oral health and discuss the links between the two. And our presentation is called It Takes Heart to Be a Hero. And today our objectives are to have you guys be able to possibly reduce the amount of active caries in CVD patients just through oral healthcare, and then increasing patient knowledge about the oral healthcare system, increasing patient knowledge on where to get oral health care without insurance, and then be able to provide oral care prevention services, and then also be able to increase patient knowledge on the link between periodontitis and CVD.
Okay, so now we're just going to take a few minutes to take the pre-test. So go ahead and pause the video, take the pre-test, and then you can play once you finish.
Indiana ranks 39th for prevalence of heart attacks in the United States. It's the leading cause of death in Indiana. Vanderburgh County in 2018 had a greater incidence of CVD deaths compared to the average for the United States. 28% of Vanderburgh County's population is obese.
The link between these two is that there is an increase in cytokines, which then lead to tissue damage.
How does having an unhealthy mouth relate to having an unhealthy body? So periodontal disease could be a risk factor for cardiovascular disease. One of those reasons is chronic inflammation, and that leads to elevated levels of C-reactive proteins, and those C-reactive proteins are key markers of cardiovascular disease. Another influence is long-term presence of plaque, and that means that there's a possibility for bacterial infection in the blood, and that can travel through the blood to the heart valves. And patients with periodontal disease are 4 times more likely to have a heart attack or stroke.
Signs of periodontal disease to look for are red gingiva, inflamed gum tissue, patient bleeds while brushing, or avoids brushing due to pain.
With healthy tissue, it's going to be pink, and then it's going to look stippled. So it's going to almost look like an orange peel with like the little dimples. And then the papilla, which is the gums between the teeth, are going to be pointed or knife-like.
And then here's an example of what diseased tissue is going to look like. The gums are going to be red, they're going to be glossy, the papilla is going to be blunted, and there's going to be bleeding. And you can see this picture here is a good example of that.
Some things to implement during a patient's stay at the hospital is basic oral care, which is brushing, flossing, and mouthwash, an oral cancer check, caries risk assessment, so if they have dry mouth or restorations, and depending on their soda intake as well. Informational brochures about perio and CVD, brochures with contact information to dental facilities, removing sodas from vending machines, and incorporating brushing after meals during patient stay.
And then these are just some images of places to look for your patients. A lot of common areas for oral cancer are the lateral borders of the tongue and then the lips, and even showing your patients these areas to check for when they're at home as well.
So take a minute to answer this question among yourselves. But why would it be beneficial for a patient to brush their teeth after each meal?
Depending on the patient's caries risk assessment, there may be modifications to oral care, such as like drinking soda with a meal instead of throughout the day, or altering home oral care recommendations, or alter at-home oral care recommendations, such as using a Listerine mouth rinse with fluoride instead.
And then with a high-risk caries assessment, you're going to see frequent snacking on sugars throughout the day. So things like sodas, energy drinks, or cariogenic foods that are sticky, like Cheetos or like Sour Patch Kids. And then if they've had exposure to chemo or radiation therapy, if they've had 3 or more carious lesions in the past 36 months. So these could just be questions that you're asking your patients while they're there. And then if they're missing teeth due to caries, so that would be another question you would ask. If you've noticed they have a lot of missing teeth, maybe ask why they are missing, and if they were extracted due to caries. And then if they have severe xerostomia.
So for moderate risk on the caries risk assessment, This could include things like no exposure to fluoride. So if they have a fluoride-free toothpaste, they drink bottled water. And then if they have no dental home, any overhanging restorations, if they're taking any medications that cause xerostomia, and then some other factors are abusing alcohol and any visible plaque buildup on the teeth.
In this photo, you can see what biofilm looks like, and whenever it builds up, it can cause irritation to the gingiva, and that can cause gingivitis and bleeding gums. Also, whenever the soft deposit is on there for so long, it can form into calculus.
So, how can overhanging restorations indicate caries risk? So, these are a problem because they are a good place for food and plaque to get trapped, especially if they're unaware that it's there or if they're not using the correct dental aids to remove it. And then it's a possibility for recurrent caries as well. And this is just a picture showing how it's not formed exactly to the tooth and it's kind of jutting out. So if you can imagine another tooth beside there and how there's a little space, it's super easy for things to get stuck there. So it's important to keep an eye out and just kind of see. And if you notice that there's a lot of plaque sitting there, that could be a conversation you have with them, and then just have them focus on that area and removing plaque.
So, onto the low risk section of the caries risk assessment. Some things that would move a patient into the low risk category would be regular fluoride exposure through water or mouth rinse and toothpaste, if they have a regular dental home that they see, and then no new caries lesions or restorations from caries in the last 36 months.
Some examples of basic oral care are the modified BASH method. Angle the soft toothbrush at a 45-degree angle towards the gum line and flick the toothbrush out. Flossing. Once floss is inserted interproximally, move floss up and down in a C shape. And also adding antimicrobial mouthwash like Listerine, and then incorporating an oral cancer check and making sure to check the lateral borders of the tongue and lip.
And this is just an example of the modified Bass technique. And you can see how the toothbrush is angled toward the gum line. And now you'll kind of flick out, removing any plaque and biofilm up along the gingival margin and just going along the whole mouth and doing that all the way around.
And then here's an example of the C-shaped flossing method. You would just wrap it in a C shape around the tooth and move it up and down.
These pictures are just showing some areas that are kind of suspicious when doing an oral cancer screening.
If patients are only brushing once daily, when is the best time to do so? And the best time to do this is before bed, just because everything they've ate that day, instead of sitting on their teeth all night, at least they're removing it at night before bed.
So some local dental offices in Evansville are Heritage Family Dental, Diamond Valley Dental Care, and Aspen Dental. And all the addresses for those are up on the screen as well.
And then some safety nets or places that patients can go if they don't have dental insurance are Echo, and they provide cleanings, fillings, extractions, partials, and dentures. And then you could either have no insurance, and they also accept Medicaid and Medicare. They're open Monday through Friday, and then the address is up there as well. And then another place is USI Dental Clinic, and we offer cleanings, radiographs, sealants, and dental exams. And you don't have to have any insurance. Adults pay $35 and veterans are free. And then children are 10 and adolescents are 15. And then evening hours are available as well. So for people that work during the day, they don't have to take off work. They can just come in at 5:30 after work.
All right, you've made it through the whole presentation, and it's time for the post-test to kind of check your knowledge and review what we learned today. Thank you all for watching. We really appreciate you taking the time to watch this video and join us for this presentation today.